Hello friends, I am Pranita Sheshni, the student of Brisang Training Center, and today I am here with you to discuss the topic of the pharmacovigilance, that is the adverse event and types of adverse event. The adverse events are any undesirable experiences associated with the use of the medical product in a patient. They can vary in severity and nature, and understanding these types is crucial for the patient safety and the regulatory compliances. Here, it is a there are types of the adverse event are as follows. In that, the first is the type A, that is the augmented adverse event. In that these events are predictable and related to the pharmacological effects of the drug. They occur due to an aggregation of the drug's known effects, for example, hypoglycemia from the insulin, and accepted outcome due to the drug's mechanism. And another example, that is the bleeding from the anticoagulants. In that, the excessive bleeding is known risk of the blood thinners. The next type, that is the type B, that is Bisray adverse effect events. These are the unpredictable and not related to the drug's pharmacological property. They can occur in the susceptible individuals or due to the idiosyncratic reactions, for example allergic reaction. In that, such as the anaphylaxis to the penicillin. And second example, that is the Stevenson Johnson syndrome. In that, a severe skin reaction that can occur with the certain medications. And the next most important type, that is the type C, means the chronic adverse event. In that, these are associated with the long term use of a drug. They may not manifest immediately but can lead to a significant health issues over time. For example of the type C adverse event, that is the osteoporosis from the long term corticosteroid use. In that, the prolonged exposure affects bone density. And another example, that is the kidney damage from the NSAIDs, means the long term use can impair the renal function. Next type, that is the type D, means the delayed adverse event. In that, these events appear after a significant period post exposure. They can manifest the years after the treatment. For example of the delayed adverse event, that is the carcinogenesis, means the some chemotherapeutic agents may increase the cancer risk long after the treatment. And next example, that is the teratogenetic effects. Certain drugs can cause the birth defectives if taken during the pregnancy. And the next type, that is the type E, means the end of treatment adverse event. This occurs upon withdrawal or the discontinuation of a drug. They can include the withdrawal symptoms or the return of the underlying condition. For example, withdrawal symptom from the opioids means the patient may experience severe discomfort when stopping. The next example, that is the rebound hypertension, a sudden increase in the blood pressure after the discontinuing antihypertensives. The next type, that is the type F, means the failure of the therapy in the adverse events. These events occur when a drug fails to achieve its intended therapeutic effects. This can be due to the resistance or the inadequate dosage. For example, antibiotics resistant. Certain bacteria may not respond to a treatment. And another example, that is the ineffectiveness of the antidepressant. Some patients may not respond to the specific medication. Then next is the medication errors. These are not adverse event in the classical sense, but can lead to a serious harm. They arise from the mistakes in the prescribing, dispensing, or administering the medications. Example, wrong dosage and the wrong medication. I think it is clear to everyone what is the adverse event and types of the adverse event, that type A, B, C, D, E and F. It is clear to everyone. Thank you friends for listening me today. Thank you again.